Hey guys, so in my presentation I will be talking about a patient who has just came into the ED and has been diagnosed with an ischemic CVA, and I will be kind of teaching you guys about what the patient care will look like from when the patient arrives to the ED to when they are admitted to the medical floor. So here are my 3 learning objectives for my presentation. So first we're going to explain the management of CVA. We're going to describe diagnostic tests for CVA, and we're going to identify signs and symptoms of CVA. So this here is the patient scenario that we will be taking care of throughout my presentation. And this is what an ED note would look like when a patient comes in. So the ED note says that this is a 40-year-old male brought in by ambulance. Family stated he started slurring his speech and could not move the right side of his body. Per family, last known normal was 1 hour prior to arrival to the ED. He has a history of smoking times 10 years, alcohol abuse, hypertension, type 2 diabetes, and noncompliance with medication. So usually when a patient comes into the ED with stroke-like symptoms, they will call overhead a code stroke. That way everybody is on board and CT has a room cleared out for them to be there to get a CT scan. So here we have our assessment data on our patient that just came into the ED. So of course we have allowed him to go get his CT scan, and now he is back in his room. So our patient is alert and oriented times 4. His speech is slurred and delayed. He follows commands. As you can see, his right side is very weak and his left side has full strength. He has a right-sided facial droop. His vital signs: he has a temp of 98.4, a heart rate of 92, respirations are 18, blood pressure is 170/94. He is 98% on room air, and he declines any pain. So on this slide, I have linked the NIH stroke scale if you wanted to click on that and see an example of the stroke scale. I also have it printed here, and it literally tells you in every box like what to ask them, how to assess it, and how to score them. But you can click this link so you can see it better, obviously. Okay. Alright, can you tell me where you're at today?
I'm at the hospital.
And what year is it?
2024.
And when's your birthday?
January 9th, 2004.
Alright. Can you blink your eyes and raise your eyebrows for me? And smile real big so I can see your teeth? Okay. Can you squeeze my hands? Alright. What about lift your arms up for me? Can you raise this one any higher? Alright. Good job. Okay. Can you raise your legs any? Alright. I'm going to lift this one up and try to hold it up as much as you can. Alright. You can put your feet down. Can you push me away? Okay. Alright. Good job. So here is a set of orders that you will most likely see when you have a patient come into the ED with stroke-like symptoms. So of course we're going to do vital signs, we're going to do a NUR assessment and an NIH assessment. They're going to be strict NPO until they pass the nursing bedside swallow eval or either the speech therapist swallow eval, depending on what the doctor orders. We're going to do continuous cardiac monitoring. We're going to have at least 2 IVs just in case they need fluids, any other type of medication, as well as TPA. And our patient has actually qualified to have TPA, so we need to make sure that we get an accurate weight so that dosing will be accurate. And a stat head CT, so that is when the patient first comes to the ED, we want to take them straight to CT, and later on they'll probably need an MRI. We're going to do all types of labs, CBC, CMP, a coag, troponin, and usually those are all stat. And then here, again, our patient qualified for TPA, so here's what the order will look like. I will talk more about the TPA medication in the next 2 slides. So here's a TPA math question. It has been a while since we have had a TPA math question, so I figured it would be a good reminder. So the client weighs 52 kilograms and is to receive TPA. The safe dose is 0.9 milligrams per kilogram, not to exceed 90 milligrams. So what is the total dose we would give? So I did attach the answer. If you want to cover it up, do it to see if you get the right answer. That will work. So here's like a little med card on Altepace TPA. So it is a thrombolytic. It's given through an IV. We do have some nursing considerations for this though. So it has to be given within 3 hours of their last known normal. It can go up to 4.5 hours though. If they have exceeded that amount of time, then they do not qualify for this. And there are multiple contraindications to receive this medication, so we need to make sure that we are doing a thorough history and assessment on our patient to make sure there's no contraindication, and if we see anything, we need to make sure the doctor is aware. So like any active bleeding, if they've had a history of stroke, if they have severe uncontrolled hypertension, or any current use of anticoagulants. And when they are getting this medication, we need to make sure that they need to stay bed rest. That way they don't accidentally fall and start bleeding or anything like that. We need to make sure that we are monitoring their heart, and we're going to avoid any invasive procedures like inserting another IV or a Foley catheter, anything like that could make them bleed. We need to educate our patients to tell them to report any adverse reactions and educate the patient and family on the medication. That way they are aware of what they are getting. So here are just some examples of some orders you may see once our patient is admitted to the floor. Vital signs Q4, NIH and neuro assessment Q4. We're going to apply SCDs to prevent any blood clots. They'll have an MRI. We're going to have them on a continuous cardiac monitor. They'll probably have an echocardiogram done. They still need the 2 IVs at least. We want to make sure that their blood pressure stays less than 180 and diastolic less than 105. We're going to have them on a VTE prophylaxis. They'll have PT, OT, and speech therapy working with them. Heart healthy diet if they were able to swallow correctly. We need to make sure that they had the swallow eval done before we give them any kind of food. So here are just some signs and symptoms of a CVA. Anxiety, change in level of consciousness, urinary incontinence, if they're having any trouble communicating or any weakness on one side of the body, facial drooping, blurred vision, weakness, elevated blood pressure, vertigo, sensory loss. Here I have listed on the side the Think Fast acronym. Any face drooping, arm weakness, and speech difficulty, you want to get them to the emergency room as soon as possible. Or if they have already been admitted and have a change in status, you want to call a code stroke if that's what you're suspecting. That way we can go ahead and get them to CT and see if they qualify for having the TPA. That way we can reverse the symptoms and hopefully prevent them from having any severe symptoms. So here are some NCLEX style questions that you may see on the NCLEX related to a stroke. I will just let you guys read this on your own. I have attached the answers, but if you want to cover them up and try to answer them before looking at the answer, if you have any questions about these, just ask me in the comments. This is my NCLEX RN detailed test plan. I use reduction of risk potential because in our order said we have to apply SCDs, and that was part of it. And also we placed 2 IVs. I also used management of care because we collaborated with physical therapy, speech therapy, occupational therapy. And then I used pharmacological and parental therapies because we used calculations for the TPA administration. And we also reviewed the patient's history and what medications they were taking before administering the TPA.